Hello, hello. Welcome to our panel discussion, Sis You Got This, Realities of Professionals Living with Chronic Illness. This is day 3 of our exciting week of virtual conversations for our 3rd annual MSK Week. Hopefully, if you've been tuning in this week, you've left the first 2 conversations inspired to focus on prioritizing your mental health, because that was our goal. And today's no different. We're here to shed light on the mental health toll that comes with navigating chronic illness while pursuing our professional paths as young people. Because adulting is hard, and it gets even harder with the chronic illness. The panelists and I hope to share experiences, insights, and coping strategies as it relates to this topic. I wanted to start off by sharing a glimpse of my own personal journey. So my name is Bilquis Habib, and I'm the manager for the My Sister's Keeper program, also known as MSK here at the Black Women's Health Imperative. I've been living with sickle cell anemia since birth, and in my early years, I found myself frequently in emergency rooms and hospitals. Dealing with the complications that come with this condition, it's been a lot. So needless to say, the clinic and hospital staff quickly became my besties. Even when I wasn't in hospitals, I never really felt at ease since I lived every day kind of on edge and anxious since I didn't really know what would trigger an immense painful crisis. Along with that, I was always tired, and not the tired that, you can sleep off, but it was a deep, spiritual type of tired. But as I grew older and my treatment plan evolved, I started to find a way to live beyond my illness. Of course, like any chronic condition, I have to stay mindful of my body and mind since there's an invisible weight that I carry given that I don't look like what I've been through. But throughout the journey, I have been blessed with a great support system along the way. I've learned that as I've gotten older, each stage of life comes with a new set of things to keep in mind and to be mindful of in order to live as healthy as possible. So for the longest of time, I've kept my diagnosis to myself, silently battling the challenges that come my way, which can feel pretty isolating at times. But now I'm in a place where I'm comfortable sharing my story, and hopefully it'll be, some good to open up and, inspire someone else to be authentic and share their stories and build community through it. So without taking up much time, I want to introduce you all to the other 2 amazing people I get to be in conversation with, and hopefully along the way, those of you at home tuning in will be moved to share too. So first up, I'd like to introduce Tiana Wolford. Tiana Wolford was born and raised in Baltimore, Maryland. She's always been talkative, friendly, and full of life. She has sickle cell anemia as well, and has faced numerous health complications as a result. A true fighter at heart, she has recovered from numerous complications, including bilateral hip replacements, a failed bone marrow transplant, many pain crises, and several other complications. She has a zeal for affecting change throughout the sickle cell community and understands the realities of those impacted by the disease. While sickle cell has been a huge part of Tiana's life, she does her best not to let sickle cell define who she is. Tiana has also been blessed to sit at some incredible tables and contributed to publications and working committees with the American Society of Hematology and NHLBI. She's also the founder and CEO of a new nonprofit organization, the Sickle Cell Reproductive Health Education Directive. Thank you so much for being here, Tiana. You're kind of like, a superstar in the sickle cell advocacy world. So I'm very, very, very good to, have you in conversation with me today. So next up, we have Asiria Daniels. Asiria Daniels is the perfect mix of humanitarian and hustler. Earning her undergraduate degree from the Citadel, the Military College of South Carolina, and her graduate degree from Georgia State University, she currently serves as program coordinator for the Center for Black Health and Equity. She is passionate about serving and improving underserved communities, and as a public health strategist, Ms. Daniels is dedicated to improving health and racial equity through advocacy, community engagement, multi-sector partnerships, and she's nationally an engaging speaker, a public speaker and expert bridge builder. Asiria enjoys developing and maintaining partnerships with faith-based tribal nations, local, state, and federal and state and federal agencies. Outside of her professional work, Asiria enjoys sharing her experiences living with lupus. As a lupus warrior and board member of the Lupus Foundation Georgia chapter and building father-daughter relationships in the Black community, Ms. Daniels delights in being her authentic self in all aspects of life and hopes to be an inspiration to the little Black girls across the world. So it's great to have you as well, Asiria. Thank you so much for all you do in your community and for just being an inspiration to everyone. So without further ado, I just want to check in. How are y'all doing today?
I'm good. I'm so excited for this conversation. I'm a little tired, but I feel like even just hearing the bios, it has me inspired and ready to go. So I'm excited.
I'm glad to hear it. How about you, Asiria?
I'm super excited for this conversation. It has been a heck of a day today. So
yeah,
so to have this panel on the day that I've had is we here. It's really putting the test.
I really felt the chuckle. So, we're going to get through it today. Hopefully this is going to be a, bright spot for you all this evening. So before we get started, I wanted you to, each touch on the journey that you've had with your chronic illness and how it's shaped your professional career and what you do in your communities. So whoever wants to go first, feel free.
Yeah, I can start. So, just a little bit about my journey. I was diagnosed when I was 15 years old, while we were stationed in Okinawa, Japan. So that was a trip in itself. We were not in the United States. I had to be medevac to Hawaii, which was a 9-hour flight. If anybody knows anything about lupus, usually you are diagnosed when you're older. And me being 15 years old, my whole world shifted. I was an athlete at the time, so a lot of what is my career going to look like? What does college look like? What does dating look like? Those were kind of the questions I asked. But I echo Tiana in having a great support system, and you having a great support system. My mom's a nurse. My dad was my coach, and so we were really blessed to have people who surrounded me, who gave me great advice. But at that time and growing up with this disease, I've realized that the advice that I got was great. It was fantastic. It was wonderful. But I was getting advice from women who were 30, 40 years old on their second kid. And I'm 15 going, well, I'm
Right.
trying to be like you, but they've already had life before the diagnosis.
Right.
And so now I really advocate for just resources and having conversations around this topic of having a chronic illness, especially lupus, as a child, because you grow up with it. And some of the things that I was missing during that time, I tend to really advocate for, have those uncomfortable conversations with friends and family of the people who have the chronic disease. Because just because I don't look like I have lupus doesn't mean that some days I can't get out of bed, right? So I just like to highlight that aspect of it, and really just, I'm a lupus warrior. I'm warring every day with it. I may not look like it. Bless the Lord, but but it is a part of me, but it doesn't define me.
That part. I think I can truly relate with that because it's easy to just look at somebody and not know what they're going through, but you know the silent battles that you're battling. And support is key. So I know everyone shouts out their moms. So shout out to my mom as well, because she's really held it down for me for real, because I would not be here without her. How about you, Tiana?
Yeah, so everything that you guys just said really resonates with me. Obviously, sickle cell is a genetic condition. I was born diagnosed with it at 3 months old. My mom is also a nurse. So she had actually taken an interest in sickle cell as early as the 5th grade, like way before she knew she'd have a daughter with it. And I feel like the way that my mom was a single mom, my grandparents, my uncle, we all lived in one house, and they really kind of raised me to believe that I could do anything with sickle cell. I might just have to do it differently, and it may take me longer. And I feel like that really helped me as I got older. And growing up, I always say that I did relatively well. And that's really just looking in comparison to like the other children that I watched in my pediatric hematologist office, because actually I would get hospitalized as a child like at least once a year, maybe twice, with something called acute chest syndrome, which can actually be fatal. But like I said, compared to everyone else, I felt like I was healthy. And so things really didn't start spiraling out of control for me until I hit puberty, about age 15. So by the time I was 16, I had like both of my hips replaced. I had been in liver failure from a delayed transfusion reaction. I missed like 80% of my junior year of high school and 60% of my senior year of high school. And I went to a predominantly white school where they were like unapologetic about the fact that they didn't understand sickle cell. And I used to get comments from teachers and administrators like, wow, it'd just be so much easier if you had cancer, because then it's more predictable and we know when you were going to miss school based on your chemo treatments. But with sickle cell, like we never know. We just feel stuck. And I feel like being in that environment is really what taught me how to be an advocate for myself. And then, things kind of got worse by the time I graduated high school. I just felt so defeated by the disease. I was in the hospital like every 2 weeks, all these surgeries, infections, pain, just a mess. And so that actually led me to have a bone marrow transplant. It was a clinical trial. My mom was only a half match. She was my donor. And like I said, I just felt so defeated. Like I didn't want to keep living my life like that. So I knew that like chemotherapy and radiation was involved. And I told the doctor at my first consultation, like, I'm willing to risk anything to be cured. I just don't want to be infertile. I've always wanted a lot of children. And that was really dismissed. And I remember looking into like education for egg freezing. And when I saw the cost, that's when I started looking for financial resources. And what I found was like a list of grants from foundations, but you had to have a diagnosis of cancer to be eligible. And I reached out to a couple and I was like, yeah, I don't have cancer, but I'm getting chemo and radiation. Like maybe we can squeeze me in. And long story short, it didn't happen. And unfortunately, I had to really make a choice between a cure or fertility. And I actually ended up rejecting that transplant. So now here I am at 31 with sickle cell still and infertile. But that is what led me to start my organization, the Sickle Cell Reproductive Health Education Directive. We call it SCRED for short. And it's actually the first and only sickle cell organization in the entire world to have a mission around sexual, reproductive, and maternal health.
Yeah, no, that's very, very, very heavy. And it's one of those things where when you hear people talk about their experiences with healthcare providers, with, people in their community from school to friends, there's just a lot of misconceptions that exist, right? And there's just not a lot of education going around, especially for diseases that do affect, women like us, where you'll get a little tiny paragraph in those, biology textbooks, and it's like, oh, sickle cell is this. And it's just like you get to talk to different doctors, even primary care doctors who may not know anything about sickle cell. And it's just like, it's frustrating because you're going to a professional just to get professional help, but you're not getting that help for real. So, it's on us to, really educate, which is unfortunate, but, it comes with the, task of having these chronic illnesses. So my next question for you is like, what misconceptions about chronic illness have you encountered and how have you worked to challenge them in your personal and professional life? I know, Tiana, you mentioned your teacher saying that it would be easier if you had cancer, and it's like, that's crazy because there's nothing easy about cancer. It's just, maybe a little bit more common where everyone knows somebody who may have a type of cancer, but to just dismiss your lived experiences, especially since there are a lot of similarities with these types of illnesses too, is kind of off-putting. What are some other things that you've encountered?
I think the misconceptions. So one of the things with sickle cell is like particularly with SS, the genotype that I have is that your red blood cells break down really fast. Mm-hmm. And so that leads to fatigue. And so there are some days when I could have a million things on my to-do list, but I just cannot get out of the bed.
Right.
And it's one of those things that's like, I'd almost rather be in pain because I've learned to work through pain. I have a really high pain tolerance, but that fatigue is something that just knocks the wind out of me. And so a lot of times that can be misconceived as like laziness.
Laziness, yeah.
And that's the one that really irritates me because I'm like far from lazy. Another common thing that we deal with in the sickle cell community is like this thing about drug seeking. Pain is like really known as the hallmark for sickle cell pain episodes. And so I feel like when you're in this pediatric world, your pediatric hematologist, they're empowering you to know like what medications you need at what doses and all of that. But then you get thrust into the adult world and you're showing up at an adult emergency room asking for this narcotic at this dose. And then all of a sudden it's weaponized against you and you're drug seeking.
Right. Yeah, I've experienced those things as well. And my brother, most recently, he's in college right now. He had a doctor actually tell him that he actually does not need medication. He also has SS. So it's unfortunate just to see all these racialization of, our illnesses as well. What about you, Syria? What are some things that you've seen?
Yeah, so a misconception with lupus, I think for the biggest one, I think I mentioned it, was we don't look sick, so we aren't sick. My undergrad was at the Citadel. I'm very proud to have gone there. It's a military college, had to get a medical waiver to even go there. But I remember one of my superior officers, who we called a TAC, I was having a really, really bad flare up, and he came into the room and he said, "You don't look sick. You're not sick. You're going to formation." And I just remember bawling, crying. And my teammates at the time, because I did track and field there, my teammates at the time had to like rush over and let him know, like, hey, we had a track meet. My joints are hurting. I couldn't even walk into the barracks. And then we had to get the doctor who finally gave me the medical waiver to go. He was a huge advocate for me, but he had to come to the barracks. And mind you, only cadets, only people who were actively going to school there were allowed in the barracks. And we had to get our medical doctor to come and tell him, like, hey, this is real. Like, she may not look like it, but this is real. So one of the main misconceptions when I tell people I have lupus is, oh, you don't look like it. And I'm like, well, what am I supposed to look like? Because I feel like it. The conversations that I have to have with my doctor, especially growing up, and now I'm 27, what does motherhood look like? What does things of that nature look like? Like that's real. That you can't see that, but that's the emotional and mental toll on top of the physical toll of what chronic illness can do.
No, that's real. That's really real. I think one thing that I would like to add is the fact that going to an emergency room, right? You may have to like, amp yourself up, hype yourself up to get in the car to go. And you're thinking like, oh, I really don't want to go. I don't want to deal with these healthcare providers. They're not going to believe me. I might crack a little joke, just, to keep from crying, you have to laugh to keep from crying. And I think that's one thing that's a little bit heartbreaking where you can't even, cope with yourself without it being perceived as you not taking your illness seriously, even though that's just something that you need to comfort you at the time. So, how do you think, your experiences with these healthcare providers affected your ability to manage your chronic illness? So I know, Esther, you just mentioned that you're talking with your doctors now about, reproductive health and how your treatment may have impacted that. I have my own stories, but I want y'all to go first. So
Yeah, so currently I am actually pregnant. And this was planned. So yeah,
congrats.
it's exciting. Our baby is due in August, but
Nice.
this was a year and a half process. So this was us testing genetically, making sure that, although lupus, people say it's unknown, it can be genetic, it can be environmental, things of that nature, just making sure that the child that I would be able to produce, if I would be able to produce, because that's a whole nother conversation, um, that would not have any genetic modifications or anything like that, any deformities or abnormalities. With me, I was very blessed to have a rheumatologist when I first got diagnosed who believed in me, who actually called the doctor I referred to at my undergrad and told him, I'm more worried about her getting struck by lightning on a soccer field than I am about her lupus flaring up. She's a strong woman. She'll be a strong woman for your school. And so for me, I have been very blessed to have doctors in my corner. My current doctor right now, again, this was a whole process. So as soon as I moved up here to Atlanta, her thing was, and I made sure my doctor was a woman. That's another thing, having a female doctor. But she really was like, hey, what are your goals within the next 5 years? How do you want this to look? And I know you've had this since you're 15. We're going to, change some things. We're going to take you off some medicines. We're going to do some experiments. I need you to be comfortable with it. Trust me with it. It's not to harm you. But if you're ever in any not being comfortable with it, let me know. And we had open dialogue. But other doctors where I've went to the ER and the first thing I say is, I have lupus. What is that? Just put I have an autoimmune disease. And then I'll tell them in the back all the medication that I'm on. And then we can go from there. Or like having my mom having to advocate for me while I'm in the back crying in pain, and she has to tell them what their job is. So it's been a journey to try to navigate the health system, and the professionals in it. Do I think more education needs to be done? Yes. Do I think more advocacy needs to be done? Yes, but at the expense of who and what? I shouldn't have to always advocate for myself. And this is a
Right.
medical disease that has research on it, that we have stats on it, and that you should know about. At least have a general knowledge about. So it's been a journey. I've been blessed to have some great people and some great doctors, but on the other hand, it's been a journey, and it can get tiring. So hyping yourself up to go to the ER, people think I'm crazy. I'm like, oh no, I'm not going to go to a doctor. I'll just wait to talk to my rheumatologist and wait to go see her. Well, you can get sicker. I rather
Right.
deal with her who knows it than to
Mhm.
go to an ER and they dismiss that I'm in pain. They don't want to listen to me and they don't know what lupus is. So it can be a blessing and a curse sometimes, for sure.
Yeah. There's so many similarities.
Right.
So first of all, just related to like the reproductive health, I think that in sickle cell, historically, we've really focused on like survival and not really quality of life. So there's been a lot of like, how do I keep them out of pain? How do I protect their organs? But things like delayed puberty, sex,
Yep.
relationships, pregnancy, fertility, hormones, that really was not talked about. And that's a huge part of why I started the organization that I started. So it really, even though growing up I did have like an amazing team, that reproductive health was not addressed. And then it was a couple of years ago, I got a new hematologist who's actually now one of my co-founders. And she's like, yeah, I just don't understand why nobody's been keeping track of your fertility status. You've had all this chemo and radiation. And so the two of us, we've had a lot of conversations about my reproductive health and about my family expansion options. So I'm really grateful for that. And I'm also very fortunate because of the location that I'm in. We have like a same day treatment center.
Wow.
So it's the same thing for me. Like I can go there and not have to deal with the emergency room. And I totally understand that because a lot of times in the emergency room, that's where you deal with that stigma of being a drug seeker or somebody being dismissive and rude and disrespectful. And it's a way more pleasant experience to just deal with a team who knows you and respects you and values you. So it's been a really interesting experience. I do feel like there's definitely a disconnect between providers and individuals with sickle cell disease. One of the things that we struggle with is that we just don't have a lot of adult providers. Like historically, sickle cell was really almost like a pediatric illness because we were not living well into adulthood. And so as you age, that's something that you struggle with, is how to find that adult provider, particularly if you're in a rural area. Like there are some sickle cell warriors who have to travel 3 and 4 hours just to get to a center or a provider who specializes in sickle cell.
Yeah.
No, that's a really
Yeah.
good point that you bring up, especially the availability of a doctor, and let alone if a doctor's the way that they provide their care meshes well with you as well, because it's kind of like there has to be that synergy there
Yeah,
as well, where you
exactly.
might have different priorities. They might have different priorities where they're focused on survival, so they might be a little bit more aggressive with your treatment. Versus, my doctor now, who also sat me down and had those conversations. I'm a little bit hard headed because I did not. I was like, I don't have time to do those research studies. I don't have time to really delve deeper into my health. But she really sat me down and talked about like, hey, if this is what you want 5, 10 years from now, we need to put some things in place right now since I just turned 26. So this is like the prime time for me to like, freeze my eggs. And that comes with a whole slew of, you know, issues where I have to stop my medication that's been keeping me going for the past few years since I was 9. And that's, a scary thing because it's like, this was my crutch, this is what's been
You
keeping me
can
going.
depend on it. Yeah.
Right, right. So now it's like a new territory where it's like I'm navigating being vulnerable again in that way, whereas I don't have that protection, that barrier anymore. So how would what advice would you give to people who are looking for, a rheumatologist or a hematologist or anyone that could help them, really, help their health and help them be the best version of themselves they can be because they may not have a doctor who really, meshes well with them?
I think it's really important to seek out it's almost like dating, right?
Mhm.
Like there are some physicians where I've literally like interviewed them and tried to get to know them and it didn't work out. And what I really look for in a provider is somebody who believes in shared and informed decision making and who sees me as like a partner rather than somebody that can just tell me what to do and all of that, where we actually have discussions and conversations and ultimately they know like I'm going to do what I want, but that I value their opinion and
Yeah.
we can make decisions together.
Yeah, I definitely echo that. When I was looking for doctors up here, I was referred, and I ended up staying with her, but I did check out other doctors and I echo Tiana, it's an interview. Like my life is literally in your hands. My treatment, if I'm going to stay on medicine, if I'm going to get off, I have to be able to trust you. And so for me, it was very much so, can you fit into the team I already have, which are my parents? Again, my mom's a nurse. My dad's always been my coach. If I have a plan, he has my back. So those two, if you can fit in with us, if you can, help us to make an informed decision, understanding that I am still my own person, I'm going to make my own decisions. But I value your input. If you're okay with that and you don't have to be necessarily the boss, that would be the main thing I would say. I would also say, because I've had a doctor like this growing up when I first got diagnosed. If you're uncomfortable with the doctor, definitely leave. Like, leave. Try to find somewhere else, go somewhere else, try to find someone new. And that can be the way that they speak to you, that could be the tactics that they use. I remember my first doctor, he meant well, but I was a child, first newly diagnosed, and then he used scare tactics with me. So that didn't work for me because now I'm stressing, and what causes a flare up? Stress.
Right.
That's
Sure,
right.
you're scaring me. And so I would say, don't be afraid to leave, to say, hey, this isn't a doctor or a provider for me. Can you recommend anyone else? You can go to your primary care doctor if they're knowledgeable about it. Can you recommend anyone else, and or do research on your own? But never stay somewhere, especially with a chronic illness. Never stay somewhere that you feel you're going to be uncomfortable with, because you're going to have some very open, candid, and vulnerable conversations with your chronic illness. And you need to be able to be your full, authentic self in that room so they can make, some the best suggestions for you.
Right. So what I'm hearing is if the vibe is off, just leave. Just make sure that you feel comfortable. Don't let them dictate your life because it is your life. So make sure
Yep.
that they're looking at you as a person beyond your illness and not just you as an illness or a guinea pig or someone that's gonna use you for their own personal professional gain. So I heard you, Tiana. You said that you wanted a position who took your opinion into account, but you're still going to do what you want to do, right? So it's like, how do you both, balance your passions, hobbies, and career aspirations while you're managing your health? So a lot of complications can arise. A lot of things can kind of like hinder your path. And I know, Tiana, you mentioned earlier that you might get there, but it might take a little bit longer for you to get there. But you're still gonna get there, though. The destination is still gonna be there. So
Exactly.
how do you guys, kind of balance all of that? Because I know you guys are very multifaceted people. So how do you balance everything?
I
Um,
don't.
it's a balancing act, right? It is. I like organization, and I don't know if that's the military background that I come
Right.
from, or it's because in my mind as a child I was told at any point in time you can drop dead. So I want everything planned out. I mean, I don't know where it comes from, but part of it is making sure that everything is written in a planner. I have about 3 different calendars, one for my life, one for work, one for appointments. Balancing, I'm going to throw this in there, making sure I'm going to my doctor's appointments and making sure that if it's yearly, like I'm on it. Shout out to my mom. She makes sure I'm doing it every year. I'm good and grown, but she'll be like, oh, it's about this time. Got it, Sandy. um but then really taking time after, I have the calendars and the planners, when I'm tired, when I don't feel well, when I just don't want to do it. Really setting boundaries on not pushing myself. I am a former collegiate athlete, so I definitely love to push myself, but I also understand my body, and I want to focus on the quality of my life and not just how long I can live. And so, really listening to my body and being able to set those boundaries with friends and family, especially my close circle. As soon as I text them, hey, I don't know what's wrong, I will get back to you, they leave me alone because they understand. So making sure I have firm boundaries in that aspect to make sure that I'm taking care of myself before I can pour out to other people, whether that's professionally, personally, anything like that.
Yeah, I wish I had like something amazing to contribute to this conversation. I don't balance my work-life balance. It's just like non-existent. But I took notes, like mental notes, so I'm going to be working on that. I can say that since my professional life has just blossomed so much, I have been really mindful about like boundaries and kind of protecting my energy and who I allow in my space and all of that. So that's one of the things. And I do definitely have the 3 different calendars. I let them all get out of control, but that's my prayer for this year, is that I will find balance.
Okay. Yeah, I can echo Tiana's sentiment. I'm just up in the air, lost. I will be taking notes as well. We're learning as we're going.
Give me a call. I'm not perfect at it. Trust me, I'm not perfect at it. Again, I really do think it is my community that surround me. My parents, they definitely keep me. I'm grown, y'all, but I'm like 5 years old, still in their eyes. And so my mom can be like, "Do I need to call such and such?" I'm like, "Mommy, I'm 27. Like, still, okay, I'll handle it. I'll set that boundary." So it's not perfect, and some weeks, months, years are better, than others. But it's definitely something that I wake up every morning and I go, "Okay, you're feeling good today. We're gonna get this done. We don't have as many boundaries as we need to have today." It's a daily thing. It truly is.
Mm-hmm. And I can definitely say that I think it's really my support system, like my faith and my support system, that kind of keeps me sane. I like, just even yesterday, I was so overwhelmed by my calendar and all these deadlines. And I was with my godmother. She, even though I'm 31, she was like, "Let me just hold you for a second. Let's just lay down. Let me hold you." And so without that support, and like you said, my mother being a nurse and making sure that I literally have people even on my team who will text me like, "I hope you're drinking water today. I hope you're not eating a whole lot of red meat today." Like, and so that's good. That support system is everything.
No, I echo the support system.
My mom calling before.
No, like my mom still keeps track of my appointments. She still like reminds me of things. I still keep her in the loop, even though I'm going to them by myself. But she's just always done it since out the womb. So it was just natural to her. So I'm just thinking, like, for people who may not have, a supportive family, who may not have people looking out for them like that, what role do you think online communities and social media could play into, finding the resources they need, finding that support they need, that check-in? Because, we're in a digital age. So how can that kind of manifest in that realm?
That's a really good question. I know for the sickle cell community, it's like we're really big, but we're small and close knit at the same time. So like on social media, there's a huge presence of other people with sickle cell. And, I get that question a lot. Like a lot of people are like, "Well, I don't have the same type of support. I don't have that family that you have." And so we have this thing in the community where we call it like the found family. So you can find your village.
I would echo the same thing. Lupus warriors, we are coming out to share stories about it now. Growing up, like, I wish if I had to like be 15, I would wish it would be done now. Because there's so many creators and so many people on Facebook and different Facebook groups and TikTokers that talk about their journey with lupus. And I think it's just a beautiful thing because, again, we're not that old, but we were young on the rise of the internet. And so there is a level of transparency and vulnerability that is happening now that didn't then. Um, and so I think, online communities play a huge role to be able to connect, because we've always had communities or like foundations that you can look up and give to or go and visit. But like Tiana mentioned, what about people who are in rural areas? What about people, that don't have access to that? Online community is the next best thing, that you can find your bestie in Germany who's going through the same thing with
Right.
you. And you can share stories, because people don't understand. Like I can have conversations with my family and friends, but they can empathize, but they can't sympathize. And so I love that in this digital age, on top of TikTok dances, we are being vulnerable and transparent with what life looks like with a chronic disease. And you don't have to be in your room by yourself, struggling by yourself, saying no one understands, when you can just reach out.
No, that's real. So how would you start though? Like what, let's say I just got a new diagnosis of something. How would you start to find that community?
Yeah, I think for lupus, so I am a board member for the Lupus Foundation here, the Georgia chapter. And so we actually have social media. We have Facebook, we have LinkedIn. So you can always, for lupus, I know a lot of states have their own chapter, but then you can also go to the website of the national organization as well and look at chapters like that. The other aspect is Facebook has a lot of communities. And I have really enjoyed being a part of some of those communities as I have gotten older, to have these conversations that I have with my doctors in that community, to say, hey, this is what we're talking about. This is how I want to start the conversation. What do y'all think? And I think people think that, you're doing it on your own, but when you have a chronic illness and you're in these communities, they are willing to help. They are willing to pour into you. They have given me questions that I never thought I would need to ask my doctor. And so Facebook would be another part of it. And then for lupus as well, I think TikTok, as crazy as it sounds, Lupus Awareness Day was May 10th, and I went on just to see, the hashtags and who were doing stuff. And there are a lot of Black women, young Black women, telling their stories. And those stories look different person by person. And it's just a beautiful thing to see, because you don't usually think TikTok to go somewhere to reach out, but they are being vulnerable. They are being transparent. They are putting their treatments out there. They are putting where they stay. There are walking groups for lupus now. So just getting plugged in. You can start at the national level. You can start at your Facebook groups, but social media is really, really playing a huge role in telling stories.
I completely agree. It's the same thing in sickle cell. There are a couple of national organizations now, but definitely most states do have like their own chapter. And same, like there are so many groups on Facebook for sickle cell. I can't keep up.
Yeah.
And yeah, TikTok. I was just talking to our social media manager, and she was like, that's where we have the most visibility is on TikTok. And that's what I really find on social media is like a lot of people being vulnerable, sharing their stories. And I feel like that empowers and inspires other people to come out and share their stories and raise awareness. So completely agree. I think start with social media.
Okay. So yeah, so anyone listening in, just search up, your illness, search it on TikTok. You might find somebody who you can connect with, and we can all create a community from scratch for sure. So I wanted to pivot a little bit. We got a question in the chat. So all of us here are 26 up. And with that comes health insurance issues. Right now I'm in the trenches, so to speak. So
Ghetto.
yeah, I can't even wrap my mind around it as we speak. But can y'all, touch upon, navigating it, any challenges with coverage and costs? I know it varies state by state, different scenarios, but, it kind of helps to, hear from other people on how they navigated certain issues, especially with the cost of medications, ER visits, all that stuff. It racks up. It's expensive out here.
Right,
Yeah.
it is. And I can relate to, like, I'm on Medicaid, like over 60% of sickle cell warriors are. And that's where I am now. Like, now that I do have my own organization and I'm the CEO, it's really kind of nerve-wracking because I'm gonna have to be in a position where I lose the current insurance that I have. From a reproductive health standpoint, it's an opportunity though, because there are a lot of private insurance like who will cover fertility services, whereas Medicaid does not. And just from the advocacy standpoint, we have started, engaging with the Centers for Medicare and Medicaid to get some of these fertility services covered. And it's just so complex, like you said, because it's a state by state thing.
Yeah, it definitely varies. I think my journey with health insurance has been a journey to say the least. I grew up military. So for me, when you're in the military community, you have your dental, your health, your vision automatically with TRICARE. Aging out was very heartbreaking for me because I had never been in the quote unquote civilian world of healthcare. And I aged out at 23. But with that, I truly, for me, because of the work that I do in public health and who I've worked for in the past and things of that nature, that's always been one of the first questions I ask in an interview. It is, what does your insurance look like? And then salary comes second. And that may sound funny to other people, but when you have a chronic disease, copays, they add up. When you have to go to the doctor, when you have to go blood work, that adds up. And so definitely for me, how I navigate it is really, it's at the forefront of everything that I do in my professional work. And I have a reminder, again, my mother, well, what does their healthcare look like? What plan do they have? And so it's, putting that on the forefront and how to communicate that during my interview, so when I do come on, it's already at the forefront, like there's no surprise.
Right. Yeah, because those fees, man, I get the bill and I kind of had to squint like that Winnie the Pooh me.
Opening it up,
Yes, like, ooh.
just gonna wait until we go back to the doctor's office because this says it's not a bill, but it says I may have to. Oh, we're just gonna wait until they tell me.
Right.
Yeah, then they add extra stuff. It's, oh, let's just check this. Like, we can't check out none of the other
No,
stuff.
we
Like,
can't do that.
yeah, we can't do that.
That's not what my doctor said.
Right. We don't cover that right now. But yeah, no, like all that is stressful. So like how do you even like cope with that? Like how do you like get the time to really like practice that mindfulness, practice that, protect your mental health as you're protecting your physical health? Because navigating that in of itself is stressful. And with flare-ups, stress is a huge, huge, huge thing. So how do you keep it balanced even though the world is hectic?
Yeah, I think part of what I do is I let my employer know up front, at least someone on my team up front, about my diagnosis, just so they don't have the misconception of I'm lazy, I don't want to do anything, that type of thing, but also really keeping, again, a schedule of what my appointments are and really scheduling around my life. Honestly, I have to make sure that I'm going to these appointments, whether they're virtual or in person. And so making sure that I'm prioritizing those appointments and not getting mentally stressed on, okay, I have to go to an appointment, I have work, I have this, I have that, but really putting self-care. What I call self-care is putting my appointments first. If I don't go to this appointment, if I don't know my labs, if I don't understand what's going on, that's happening inside me that I can't see, then I'm going to be more stressed out. And I'm going to feel terrible and tired and exhausted. And so that is just some ways that I do it.
I'm in a really fortunate position with my organization because I'm the boss. And so it was really important when I founded it to make sure that I surrounded myself with a team of people who I knew would understand and who would not just rally behind my organization, but rally behind me.
Yeah.
And so one of the challenging things that I'm dealing with, like I said, is the infertility. And people are like, so why would you start a reproductive health organization where a lot of what you do is talk about fertility and pregnancy and all of that? And it can be very like empowering on most days, but there are some days like I'm human. I don't want to talk to somebody about IVF right now. And so just being able to keep that open dialogue with my team, like, hey, you guys, I know I was supposed to interview this person about their pregnancy. I can't do it today. And, there was a time last year where I was just so overwhelmed and I just had to tell my co-founders, my board, like, I'm gonna have to walk away for about 3 weeks. And it's just been amazing to have a team of people who will not let me fail and who, like I said, not just care about the mission, but care about me as a person.
Yeah.
No, that's real. That's real. So with work, do y'all work in person or remotely?
Remote.
Remote.
My day to day, I work remote. But I do a lot of traveling, so that's why you can hear the fatigue in my voice. Because every week this month, I've been like on a flight, and that it just has to, like you said, make sure that I'm doing what I'm supposed to do to take care of myself. So like hydrating, resting, setting some boundaries. Like if I'm speaking, it's a requirement that they fly me in the day before so that I have time to like rest, chill, hydrate, and not just have to fly in and fly out. So just kind of like knowing what works for you and, being really upfront about those things.
Yeah, I echo that. I don't travel as much as you, but we do travel for work that I do. And so I always try to schedule a day before. If we get done early enough in the day for training or anything like that, I'll try to come, back that night. But if it can be, late, if it's late, I'll come back the next day. So making sure that that schedule, really planning life around that schedule as well, and then making sure when I'm done flying or traveling, if I had plans prior to, like we had a family dinner, it was supposed to happen and it got canceled. And I was like, bless the Lord, we don't have to do it. Or game night, like, can we do the game night at my house and y'all bring the food? I'll just be there. But then the other aspect of it is I have a morning routine, which really allows me, I think most people think to set up your day, and it does, but it definitely allows me as well to really clear my head and to take time to just be with myself. I don't have any work. I don't have to answer a phone. I don't have to answer an email. I'm not flying anywhere. I can sit out on my back porch or in my living room and really just decompress and think about, okay, this is what I have to do today. How am I going to manage this? If I don't, what has to get done? What can get done and what's not going to get done, and that's what I do, try to do every morning, is really just take time, spend time with God, and then go into that mindset of, okay, this is what you have to do today. And working remote helps with that because I can have that routine, and at 8:30 I'm checking emails now. Like, I can just go from my kitchen table to my couch, or to, my island, and do the work that I need to do. I don't have to get in a car. I don't have to sit in traffic, and that can cause fatigue and exhaustion. And I'm just really blessed that I don't have to do that.
That morning routine is everything. And with
Yes.
all this travel, I haven't been able to do it the way that I usually do. And it's affecting me mentally because it's the same thing. Like, I'll usually wake up at like 5, pray, meditate. It's quiet. It's just like me and God time. And literally have my phone like on do not disturb until 8 a.m. There's times when like people will call you with craziness and like, no, I'm in a space of gratitude. Like, leave me alone right now. So I just started putting it on do not disturb. Skincare, like literally, like you said, not checking emails till about 8. And at one point I had gotten really good about kind of shutting the day down. because sometimes that's another thing, working from home is like, it's hard to shut work off when my office is in the basement.
Right.
But at some point I was really good at like, okay, as long as I got done everything that had to get done, whatever's left can, go until tomorrow. And by 7, like, it's just family time.
Yeah.
No, that's good. That's the morning routine, I think, for me has been key as well, just to help center myself. Because, you can go to sleep with some craziness, wake up with craziness. Your whole world is just going to be upside down at the end of the week. So
Exactly.
I don't want the weeks to just go by. So I usually, wake up early. I'm Muslim, so we have to wake up early in the morning anyway. So do pray, have my connection with God and everything, and go to the gym just because, try to keep that body right. So trying to make sure I'm doing everything that I need to do. But like, I think having remote work really does help with that flexibility where you don't have to be physically in an office that's away from your house until a set time. So I think that's helped me prioritize my self-care because I'm able to kind of like set my own boundaries in a way. But then life just also happens too because of what you mentioned, Tiana, where it's like there's a blurred line between work and home. And it's like, my phone's right here. I can respond to that email, but it's already like, 9 o'clock at night. So
Right.
that's
Right.
yeah, it's still a struggle, but I guess learning as we go and trying to really maintain that I need to do this for me. This is my me time. I need to really prioritize that and just put your phone on do not disturb. My phone stays on do not disturb. I think that's key. So I know with everything that we've mentioned thus far, it might seem very heavy to people who may be listening who may not be familiar with our illnesses. It's like, damn, y'all go through a lot. How are y'all still smiling, giggling, kikiing, and everything? And it's like, it's hard to explain. I know for me, dark humor, I joke about everything. So it's like, if someone listening on my conversations, my brothers, they're like, oh, y'all are really some messed up type of people. That's crazy. But it's like, that's my form of, having a positive mindset. So how do you maintain that through the dark times, and what advice would you give to others trying to seek that balance of not feeling doom and gloom all the time and not feeling all depressed about their situation, which is natural, but also to find some positivity within that darkness?
I think for me, like faith, family, friends who are positive, like you have to surround yourself with other positive people. And then also, I would say that one of the darkest times, probably the darkest time in my life, was when I rejected my bone marrow transplant. Like I just knew with everything in me that I was going to be cured. But had it not been for that transplant experience, I would not have my organization. The sickle cell community would not have this organization, which is literally, we have a global mission. And so I think back to that time when I'm going through some other things and just remembering that like there's another side to it, and that even though I'm feeling a certain way right now, it's temporary and I can overcome it.
I'm definitely going to echo Tiana. Prayer, my faith. That is the first thing. We are a praying family, so we're going to get on the phone and pray. But the other part for me is feeling my feelings. Like I said, today was a hard day. I probably cried all day, all day. But being able to be in the space and being surrounded by people who allow you to feel those feelings, they don't allow me to stay there. But they do allow me to feel those feelings and be able to just cry it out. We'll talk about it. Okay, next day or a couple of hours later. Okay, what is the next move? So definitely being able to feel those feelings, but understanding that you can't just stay there. And then the other part is, I think I hit on it, but just friends and family. Tiana hits it on the head every time we say this. It really is your friends and your family who really get you through times that are hard, the great times too, but making sure that your community definitely understands what you're going through and they're receptive to that. They don't just know, but they are receptive to your struggle, no matter what it looks like, because it changes from day to day.
So as a young person, how do you even find, people who do, relate to you in that way, who, kind of empower you? Because I know some friends, they may not understand what you're going through. It may be harmful than good, where it's like, oh, I don't feel good today, but they're kind of like, leaving you out of things. How would what advice would you give someone trying to navigate that, trying to find that, community to help ground them and finding friends that are actually there for them.
A lot of my friends are friends who were actually with me when I was diagnosed when I was 15. I'm very fortunate to have my best friend here in Atlanta with me, Sierra, who was there when I was diagnosed. So she definitely understands. But really, again, just being upfront with friends and family about the condition. I usually always lead with, thank you for inviting me. I'll have to see what that looks like with my schedule is
Mhm.
busy, but also how I feel and making sure that, that it's not them and it's not a me thing either. It's a,
Right.
we got to see. And also putting up the boundary of planning. So I don't do any last minute things that just kind of stresses me out. I need to be able to plan, but being very upfront and transparent in what my disease looks like. And if they accept it, we can move forward. If
Mhm.
they don't, it was nice to, be an associate. I'll see you around, maybe at brunch sometimes. But that's pretty much it. But I think we said it earlier when we were talking about the healthcare professionals. It's
Mhm.
dating. It's
Right.
dating. You have to cultivate your
Exactly.
community. And I've just been very blessed and lucky to have family and friends, church members who really see me for who I am, and really take my word as value and say, okay, this is her boundary. This is what we're going to do. And I really do appreciate that.
Mhm. Exactly. It's trial and error. Now, like the majority of the people who are in my life right now, in my inner circle, I feel like God literally just sent them to me. Like we just found our way to each other. But I feel like what was it? Like 2020 was kind of this year where God really exposed some people to me. That was kind of when I was starting my organization. And like I said, because of my own personal struggles with infertility, starting a reproductive maternal
Mhm.
organization, it made me kind of go into myself. So there was like a period where I really just all I did was work and go to bed, because I just had nothing left emotionally. And so once I came out of that, the people that were still there, they're the people that are still in my life. And the people that had negative things to say and weren't sympathetic and, oh, she thinks
Mhm.
she's better than us and all that, like you said, they're just like associates. See you at the conference. Maybe we can have brunch, but they're not in my inner circle. So it really is like trial and error.
Noted, noted. So we're almost at the time. I have like two last questions for you all, but the first one is there any policy or advocacy that needs to happen for your respective illnesses? And what would you like that to be?
That's a really good question. So from the reproductive health angle, um, when you deal with cancer, there's a lot of states where fertility services is like
Mhm.
written in, um, based on that cancer diagnosis. So when you're talking about a bone marrow transplant for somebody with cancer, a lot of times it's like fertility and a cure. But with sickle
Mhm.
cell, it's fertility or a cure.
Right.
And so that's one of the things that we're really working on is trying to get fertility services like more accessible to this community. And then recently, one of my co-founders, she put out data that for women with sickle cell, the maternal mortality rate is 26 times higher than the national average and 10 times higher than Black women. We know that Black maternal health is like a huge public health crisis right now. And so that's one of the things that my organization is going to be starting. And we actually plan to reach out to women with lupus, endometriosis, fibroids, just other conditions that disproportionately affect Black women. So we can kind of come up with like a policy wish list for how to get these maternal mortality rates down.
Yeah, so for lupus, it's definitely going to be getting the funding to do more research.
Mm.
Year in and year out, we get more and more every year, which really grateful and thankful for. But it seems like it's never enough. And so really pushing policy to make lupus a priority. I know, we talk about cancer in public health, we talk about cancer, we talk about HIV and AIDS prevention. And that is when you say that, people know about it. Your general person off the street knows about it. But lupus and sickle cell are those things where they're the silent killers. You don't look sick,
Right.
but you are sick and no one really talks about it.
Mhm.
And so, really, policy would be to just push the funding for more research. So, we don't have to have a lupus awareness
Mhm.
day. It's
Right.
already awareness.
Awareness,
People
yep.
know about it, people have heard about it. And it's not because my aunt or my mother had lupus, it's because this is being asked, I'm getting tests done or whatever, and I'm hearing it in a clinical setting. So that would be one part of it. It's just the funding. We need the funding. We need the funding to do the research so we can, find a cure.
No, I wholly agree with what you both said. I think funding is key. Money talks, after all. I think there's no way to get the research done to get a cure that doesn't involve chemotherapy for sickle cell, for example. I shouldn't have to, go through all of that, risk everything else of my life just to be cured. I shouldn't have to, struggle to get insurance and, pay for medication that I need to save my life. So I think money is the key thing here. Money's going to really amplify the things that we want to do on the ground as well as on a national level. But yeah, we're at the time. So my last final question is, how has your outlook changed? I know for me, I've had this since I was born. So my outlook has always been, trying to find the good within the bad and trying to
Mhm.
be cheerful and everything. But how has your outlook changed because of your illness? And, what parting advice would you give to everyone listening at home right now?
Yeah, I would say for me, because I had life before lupus
Hmm.
as a child, and now I have grown up with it, I definitely look at life as today is a day to be enjoyed, to be lived. And so if you ever see me out, acting a fool, it's because I'm enjoying life.
Right.
um I don't want to look back over my life and think I shoulda, coulda, woulda. So I take the risks, I take the chances, and I think because I have an autoimmune disease that was so to me as like you can just drop dead at any moment, which is true. I really take day by day as like, okay, like you're gonna have a good day today no matter what. We're gonna end the day giving thanks, giving praise that you got another day to live. And every morning it's, I thank you for the breath that's in my lungs, the
Hmm.
use of my limbs, and being in my right mind. And I know some people say that, but for me that is truly like, okay, we're going to have a good day today. My bones don't ache. I don't have any fog. I can remember what's going on. And I don't have to have a tube in my lungs like I did when I was 15. And so I just take day by day, try to make the best of it, and, try to adapt when I need to adapt.
Exactly. Same thing for me. Like you hear this thing about being grateful for the little things. And I feel like
Hmm.
having sickle cell, being born with sickle cell, and, having these times where I've been in the ICU and fighting for my life, it's like any day that I'm not in pain or
Right.
in the hospital, that's a
Yeah.
good day. And then
Yeah.
also just like it's helped me to not sweat the small stuff.
Hmm.
Like my friends will be complaining about some type of petty drama, and I'm
Right.
like, it could be way worse. You just have to keep it in perspective.
Yeah, I think perspective is key. Being patient with yourself is key. Having grace for yourself is key. And I think
Mhm.
that allowed me to give grace to other people as well, because I know how hard life can get. And I know the silent battles that people have to go through just through myself. So, I've just been very grateful to be here in community with you both today. I love being in this space. I hope everyone at home learned something, took some gems away from them. For those tuning in, thank you for your engagement and being in community with us. Be sure to use the hashtag mindfullyMSK on Instagram to further the convo for a chance to win a prize. We'll be having our final panel tomorrow, titled "Sis, Keep Your Head Up, Fighting for Reproductive Justice with All We Got." We'll delve deeper into the lived experience for those in the RJ space. So we hope to see y'all there. Thank y'all for tuning in, and thank you guys again for being here with us.
Thanks for
Okay.
having
Thank
me.
you. Thank you for having me.